Hello, my name is Stéphanie Panichelli-Batalla, and I am a professor in global sustainable development. I've been working on Cuba for the past 20 years now, and I started specializing on the Cuban healthcare programs at a global level almost 8 years ago. Before going into detail on my research, I think it's important to give you a little bit of context on Cuba. So 1959 is the year that the Cuban Revolution started or triumphed. It quickly declared itself socialist and later communist. And as part of the ideological direction that the revolution decided to take, it prioritized specific areas which are often presented as the successes of the Cuban Revolution, and these are education and health. So according to them, everybody should have access to free education and free universal healthcare. As part of their socialist program, Cuba considered that they should not limit their approach of healthcare for the masses to Cuba only, but also decided to start exporting healthcare professionals to other countries in need. This was the start of what is known as the Cuban Internationalist Solidarity Program. Healthcare professionals would act as ambassadors of the revolution, spreading the socialist values all over the world. The first short mission took place in Chile in 1961, and the first long-term mission was in 1963 in Algeria. And that was the beginning of this program that since then has sent more than 130,000 Cuban healthcare professionals all over the world in more than 107 countries. And these numbers are constantly being updated and increasing, of course, because this program is still existing and very active. There are two types of missions. The first one is what we could call a humanitarian solidarity program. So this is when doctors and healthcare professionals are sent to other countries in need in cases of natural disasters, wars, revolutions, or more recently the pandemic. And then there are the development solidarity program, which are missions when Cuban doctors are being sent because there is a lack of medical personnel, in some cases because of the remoteness of the area. So the doctors are being sent to provide healthcare, but also to train local doctors. And these are longer-term missions. So the first one could be between 1 and 3 months, the humanitarian missions, while the development missions can take up to a year and even longer than that. And in those cases, Cuban doctor tends to work for 11 months. In the mission, then go back to Cuba for 1 month, and then are being sent back again. And the number of years will depend on the agreement with the doctors and with the partner country. So some examples of these missions are, for example, Barrio Adentro. The Barrio Adentro program in Venezuela is one of the biggest programs of the 21st century. But maybe a bit more known here in the UK is the program where Cuban doctors were sent to West Africa at the time of the Ebola outbreak, and also more recently when Cuban doctors were sent to Italy and Andorra with the pandemic. So from a global sustainable development point of view, Cuba is a real inspiration in this context. It really helps achieving goals such as SDG 3, good health and well-being, SDG 10, reduce inequalities, and SDG 17, partnerships for the goals. So it is an inspiration because we have the case of a developing country with its own economic struggles with the US embargo, supporting communities all over the world to increase quality of healthcare and access to healthcare. And I'm just focusing on these goals here because we're talking about health. But in fact, we could even look at other goals where Cuba can really be considered an inspiration. We're talking about global sustainable development. However, it's also worth mentioning that others have referred to this program as medical diplomacy, because contributions to healthcare improvements have been used to improve relations between countries and achieve other political, economic, and social objectives. In this case, there is no doubt that the international solidarity programs have allowed the Cuban economy to survive in very difficult economic situations, such as, for example, after the fall of the Soviet Union, and thanks to the support and the agreements with Hugo Chavez in Venezuela at the start of the 21st century, there was a real improvement in the economic situation on the island. In addition, these bilateral agreements between Cuba and partner countries have also led to good relationships with many countries all over the world, which has influenced the vote against the US embargo that takes place every year at the UN, and where only a very limited number of countries still vote in favor of the embargo or decide to abstain. So when I started researching this topic, I noticed that there was a lot of information available about the program itself, about statistics of the impact of the program on local communities. But there wasn't that much about the participants themselves. And so I had also read that some participants who had been working on the mission in Venezuela and had escaped from the mission had accused the Cuban and Venezuelan governments of modern slavery, referring to the harsh working conditions, the dangerous workplaces where they had to work as doctors and nurses, but also to the low salaries they were receiving in comparison to what the Cuban government was earning for each of them. The term modern slavery was also later used by doctors who were working in Brazil as part of the Mais Médicos program. So I decided to fill this gap by focusing my research on the voices of the participants and trying to understand the programs better through their life stories, while also providing an insight on the impact that working in submissions had on the participants themselves, on their families, and on Cuban society as a whole. So I decided to do all history interviews, and I started in Miami, interviewing doctors who had escaped from the mission, benefiting of the program which was known as the Cuban Medical Professional Parole Program. This was a program set up by the United States, which allowed Cuban doctors working on mission to apply for an American visa if they were to escape from the mission, and then after 1 year they would receive American residency. As you can imagine, this attracted quite a high number of applicants from Cuban doctors and Cuban healthcare professionals. And I interviewed in Miami 12 of those. I then realized that, when you work on Cuba, it's good to have the point of view from the exile community, but it's also important to have the point of view from those doctors who have gone back to Cuba after working on a mission. So I decided to do the same research, but in Cuba, in Havana, and conducted there also 13 interviews in this case to doctors who had been on missions and had gone back to Cuba after that. And finally, the last group that seemed to be missing from my participants was interviews with Cuban doctors still working on the mission. So I managed to travel to Tanzania, where there is a mission of Cuban doctors there, in addition to other programs linked to healthcare. And I carried out 3 focus groups there with healthcare professionals from Cuba working at that time in Tanzania. The project is ongoing. I'm currently, with a research assistant, conducting further interviews, some of them on Teams and Zoom, others in person, to make sure that the data remains up to date. Maybe what I might just like to add about participants, to have the information about that. So the condition to be a participant in the project is to be a Cuban healthcare professional, so not all of them are doctors, who has worked on an international mission. I've interviewed doctors between their late 20s and mid 70s, depending on when they had been on the mission. I've interviewed doctors who have worked in missions all over the world, also I would say between the mid 70s until very recently. So there is a wide range of voices as part of the data. As I said, this is an ongoing project. We're currently coding 28 existing interviews, while also carrying out more interviews to have more recent data. There are many areas of interest that came out of these life stories, and it has been extremely rewarding to listen to each of these stories to understand better how each participant was affected by these in different ways. But I'm going to present to you today some recurrent themes from the interviews that are of interest in my point of view. So first of all, for many, a challenge that was mentioned was the difficulty of being separated from their families and feeling sometimes very isolated. Many are young doctors. When they go on a mission, they have to leave their families and young children behind, traveling to a country where they are faced with many cultural challenges and a language they often don't speak. So this is something that several of them have expressed as real difficulty. However, it's worth mentioning that the majority of them explain that the main reason for applying to the mission is linked to the financial benefits. As life in Cuba isn't easy and is still not easy, many of them decided to sign up for a mission, as these would give them an opportunity to improve the financial situation of the whole family. Salaries aren't high in comparison to what the Cuban government earns, indeed, nor if compared with those of doctors from Médecins du Monde or MSF, for example. However, these are much better than those of Cuban doctors who remain on the island. And many explain how working on the mission has allowed them to entirely renovate their apartments in Cuba, to buy the latest high-tech, often not even available in on the island, such as jacuzzis, air conditioning, laptop, flat screen TVs, etc. But also to afford a family holiday at the beach in Cuba, which is still quite a privilege for many of Cuban society. Others have used the program as a way to escape the island. They either knew from the start that they did not want to continue living in Cuba and considered this an escape route to start a new life in the United States. As I said, for many years, the United States had the Cuban Medical Parole program, which offered Cuban American residency to Cuban doctors who had worked on international missions. This program was put to an end in 2016 with the restored diplomatic relations between Cuba and the US, with at the time Barack Obama and Raúl Castro. But many Cuban doctors have benefited from that and currently live in the United States. For others, this is a decision that was made during the mission, and that led to the same outcome. Another point that is worth mentioning is that all of them agree that the program makes a huge difference for local communities, that the local communities are extremely grateful for their presence and their help, that Cuban doctors were highly regarded wherever they were going due to the work they were doing, but also the quality of the healthcare they were providing. And many enjoyed having the opportunity to discover new countries, different cultures, learn new languages, as they would never have had that opportunity had it not been for the program. Finally, a topic that came back in several interviews is the shock they faced when discovering extreme poverty in Africa, which is something that people in Cuba weren't used to see, and definitely not in the 80s. One of my participants said, for example, and I quote, "And then poverty, misery, that was for me. Never will I be able to forget that." End of quote. She also couldn't believe the contrast that she was seeing between the rich and the poor, luxury buildings, and then in front of them, children dying of hunger on the streets. It was for many also very difficult to accept that in several of these countries, the poor did not have access to healthcare if they couldn't pay. Several doctors who worked in Africa told me about how difficult it was for them to have to reject patients for that reason. This is not how they were trained in Cuba, and this is not how Cuba understands the role of the doctor. As mentioned before, there are clear benefits to participating in the program. But as one of my participants said, and I quote, "For many of us, it was really hard. And despite the good behind the program, it comes at a tremendous human cost." End of quote. So these are just a selection of conclusions from the initial analysis of the interviews, but there is much more to share around this. This is, without any doubt, an incredible program that allows people all over the world to increase their access to healthcare, as well as the quality of the healthcare provided, while also allowing the Cuban economy to survive. However, it is also important to make sure we listen to the stories of the participants, to understand the joys and their struggles, the successes and the challenges of the program, and to allow them to feel valued and supported. Finally, this research project also concludes that there is a lot we can learn here in the global north around our way of approaching AIDS and around our contributions and programs to achieve several of the global sustainable development goals. Thank you very much.